6:30, we can go ahead and get started. I'll need to order, and we have a few guests. Would y'all like to introduce yourselves and let us know who you are and where you're from?
So I'm a Illinois Health Education Program Manager here at BPU.
I'm Casey Warren. I am a health educator here at Chesapeake.
I'm Clint Connor, just here to speak to the board.
Thank you. Okay, and we have Angie on by Zoom. Welcome. So I need a motion to adopt the consent agenda and the minutes from the last meeting. So a second. All in favor, say aye. Opposed? Okay, it's adopted. We have a presentation tonight, Creating Healthy Communities by Jillian Drew, Accreditation Coordinator, and Janelle Edwards, Health Education Program Director. Thank you.
Jillian will not
She
be
will.
assisting Camille.
Oh, okay.
Jillian only had one slide and Camille graciously offered.
Yeah, I think I
Graciously offered to do that for her.
one. So if that was like the worst one, then you'll know that's why. That wasn't supposed to be mine. But yeah. Okay, so good evening, everyone. You can go to the next slide. I'm trying to jump right in, not to keep you too long. So yeah, I'm going to be going over the Creating Healthy Communities grant, but I wanted to give you guys some background onto how we got where we are with that. So in 2022, we received the Healthy Eating, Active Living, or HEAL grant from ODH. That was tier 1 of that grant in the amount of $30,000. And for that, we focused on Xenia, Jamestown, and Fairborn. And I'll go into more of what we did in those areas. 2023, we received tier 2 of that grant. And that year, we decided to just kind of hone in on Fairborn. Then we transitioned into the 5-year Creating Healthy Communities grant. Year 1 of that, we focused on Xenia, Fairborn, and then we did a countywide initiative. And for this next year, we're going to focus on the same areas. Next slide, please. So for tier 1 of the HEAL grant, the strategy was safe routes to healthy food. And so for that, again, focusing in Xenia, Fairborn, and Jamestown, we started off by hosting some focus groups to see what the community was feeling like they were needing. And from that, we ended on a few different strategies or initiatives that we did. So the first one being our little pantries pictured there. Each of the areas found that to be something that would be helpful, having better access to some food just close by. So we have 2 in Xenia, one being here out front, and then another one at You Are the Church, which is in East End of Xenia. We have one at the Jamestown Library and then one at our Fairborn WIC location. Also in Fairborn, there was kind of some, like, people were not aware of some of the resources in the area, is what we kind of found. So we decided to do an educational series, and that included topics on budget-friendly shopping, transportation resources in Greene County. This was a big one that people were not really aware of, being Green Cats, you know, all the things that they offer and their routes and all things like that. And then also on healthy food preparation and demonstrations. And that one was really cool because they did like a air fryer demonstration and like all the stuff you can make in an air fryer. So that one was very heavily attended. Next slide, please. So then tier 2 of that grant, again, we kind of focused on just Fairborn, with the target outcome being to increase walkability and mobility to healthy foods. So for this, we started off with conducting a 2-week dot mapping exercise throughout Fairborn, in which residents responded to 3 questions of where do you live, where do you get healthy food, and then where would you like to see better sidewalks, crosswalks, streets, etc. So they had different colored dots and they just put them on these huge maps to kind of identify those areas. And then from that, actually those maps were placed at the Fairborn Community Library, our Fairborn WIC office, and at the community meals hosted by Abiding Christ Lutheran Church. And so based on the responses from that, we were able to identify 2 locations that we wanted to focus on for next steps. And that was 5 Points Plaza, which is like the intersections of Dayton Yellow Spring Road with Funderburg, Maple Avenue and Beaver Valley. And then down Funderburg Road from 5 Points to Colonel Glenn was like the second area that we kind of focused on. And that's where the Fairborn Fish location, that's where that's located. So from that, some of the suggested, from that we did our walk audit, and then the walk audits identified some suggested improvements, which included some sidewalk repairs, shelters from the element, trash receptacles, seating, repainting, crosswalks, landscaping, a lot of different things. So we had a Fairborn planning committee that was partners, community members, some internal staff that lived in Fairborn have been participating in that for us. But so we as a committee met and determined which of those improvements we were going to move forward with. And we landed on doing a bench and trash receptacle and trying to do some wayfinding signage near Fairborn Fish, which we also got Fairborn Fish included on Green Cat's flex route. So I'm blanking on the days, but when Fairborn Fish Food Pantry is operational, the Green Cat's flex route will go that way. And I believe they also added extended hours for that day too. Also, we worked on a food access map with MVRPC, what is that, Miami Valley Regional Planning Commission? There we go. Okay. And so in that one, we were able to create an interactive map, and that's what you're seeing pictured there. So each of those different colored like dots and icons on there is like grocery stores, food pantries, I believe convenience stores, and I think we have like free meals on there too. So people can hover over that and see where these places are located and their hours as well. So that was that. Next slide, please. So then moving into creating healthy communities, there are 3 different areas for strategies that we're focusing on with that. Next slide. So the first one being Fairborn Active Transportation Plan. So for this, we partnered with the City of Fairborn and the Active Transportation Committee. We hosted several open houses in which minor active transportation education was provided to the participants, and they were asked, how can Fairborn's active transportation resources be better? Some of the responses included making areas ADA accessible, fixing and adding sidewalks, more benches, parks for children, and opportunities for exercise equipment, things like that. So we worked with them to develop an active transportation plan, and that was adopted by the City Council on July 7th. And some of the recommendations coming from that plan, protected on-street bike lanes, Dutch-style intersections, which that's a picture of. I didn't like that name. I wasn't familiar with just that name. So this is a picture of what a Dutch-style intersection is. And then better parking and connectivity for that. Next slide. The next one is the Greene County Food Council. This was something that was like trying to get started pre-COVID, and then COVID, so obviously didn't go anywhere with that. But we reestablished that Greene County Food Council with OSU Extension being contracted as like our lead for that. The membership for that consisted of some food pantry leaders, like I said, the extension offices, libraries, healthcare, and we even had quite a bit of community members, around 10 community members that regularly participate in that. So I thought that was really good. We've also got 62 individuals signed up for the listserv for that. So that's been a really good initiative that the community is really excited about. So for that, the food access map work like is kind of part of that, but they broadened that. Originally it was just Fairborn, has been broadened. Some of the other initiatives that are discussed are special diets, food drives, educational series, food waste reduction, For 2025, the food map and the food drives were the main initiatives that took place. The other ones are still planning for upcoming year. The Food Council did create bylaws that covered purpose, membership, governance, decision-making, all of those things. And also like an action plan for the meetings and things like that. Next slide. And then the Xenia Farmers Market. So this was located on Greene Street. We had it monthly, most months. July was canceled due to inclement weather, but we did it monthly in the evening, and the purpose to increase access to healthy foods in East End of Xenia specifically. We had a variety of vendors: produce, meat, eggs, baked goods, flowers. So that was really good. Next slide. This is just some data from the farmers market. So I thought they were pretty well attended. The most we had like shoppers was about 60 shoppers in August. And then that same August one, the vendors made about $600. So for a new market, seemed to be pretty good. We did not charge a vendor fee or anything. So I think that kind of speaks to the fluctuation in the number of vendors that we had. But yeah, next slide. And so then some of the questions that we did on a survey for the shoppers was trying to better understand like what brought them to the market. So majority of people came as a special event, but about 37% came with the intent of purchasing their weekly groceries, which I thought was pretty cool. And then method of transportation, 70% came to the market in their own vehicle, which is something that we're trying to keep in mind because for the upcoming year, we're considering relocating to a more visible area. And so we are trying to be mindful of just that, you know, being able to be walkable for people still, and hopefully more visibility, people will come, more people will come. Next slide. So 2026, excuse me. 2026 CHC initiatives. So again, we're still focusing on the same areas, Fairborn, Xenia, and then the county-wide initiative. For Fairborn, we're looking to do a travel ambassador program, which is aimed at helping people to use the infrastructure in place for active transportation modes, such as walking, biking, public transit, and educating on the available resources as like how the public transportation works, and then like what trails and things like that. So there's a whole program guide and stuff that's provided by ODH, which we think will be really helpful since that new active transportation plan got approved. For the farmers market, in addition to exploring new locations, we're also trying to expand to accept SNAP. And then for the food council, looking to form a local food security assessment work group within the council that will conduct various assessments and audits to gain a better understanding of some of the barriers faced, as well as continuing with some of those initiatives mentioned on the previous slide. Next slide. So all in all, sum it up, at the heart of the CHC efforts, they really want to focus on sustainability. So that's their big thing, is how are we going to keep stuff going after the funding ends. So these are just some of the things that we're trying to keep in mind with each step that we're doing, so that we make sure that the good work that we're doing remains there for the community to benefit from. So next slide. I think that's all. One last thing I will mention. So we have a new health educator working on this, not new to GCPH, but Casey is going to be transitioning from the harm reduction grant into doing CHC and safe communities. So just want to make mention of that for everyone. Any questions? Yeah.
On the SNAP program, do you think that'll be implemented next year?
So we are trying to see, and we really, that was a new space. We had wrote in the work plan, we were gonna do all of them, you know, like, and then they were like, that's kind of a lot more than you think. So let's try just the SNAP. So the state made that guidance to us. So I think I'm hopeful. Yeah,
I know when I go to a farmer's market, it's not because I'm trying to save money buying produce.
Uh-huh.
It's actually a little more expensive because of this. If I was gonna save money, I'd go to Aldi's
Mhm.
produce. So having that SNAP program, I think would maybe increase the people that show
Yeah.
up.
I
Because
agree.
they're gonna go there just to get the fresh food and be able to afford it.
Right, right. No, I agree. I'm hopeful that we'll be able to.
That'd be great. Thank you.
Yeah.
Thank you very much.
All right, thank you.
Financial report.
Sure. First report, for the night is the income and expenditure report on your large sheet of paper. We are, 11 months, through the year, so hard to believe 2025 is pretty much gone. So, 92% is what that, percent through the year that we are, that we could use, loosely as a benchmark for revenue, and again, a little bit better for expenses. But anyways, up at the top in the revenue, we always want to look at the fund that's going to account for the largest portion of our revenue and make sure that's bringing in the money that we expected it to. So for us, that's the general fund, accounts for over 40% of our anticipated revenue. And right now it has brought in 111% of what we thought it would, and is up in total 6% from this point in the year last year. So that's good. Our next largest fund is the Clinical Health Services Fund, which is your third one down. That one has brought in 105% of what we anticipated it would bring in this year. So that's great as well. Pay a little less attention to the variance column there because last year we transferred money into there. So it's a little artificially inflated due to that being in there. So that grayed out column is a better column to look at just to make sure those bring in the money that we want them to bring in. So all the way down at the bottom of that top section, you'll see that so far we've brought in as a whole 124% of what we anticipated for the year. So we've collected all the revenue we thought we would and more, which is a good thing. So then moving down to the expenses, we'd follow the same method. We would look at the general fund, since again, the largest percentage of our expenditures are going to come from there. And the general fund is at 91% expended. And again, 92% or less would be the target there. So it's right on track with where we would want it to be. It's down 32% from this point in the year last year because we have not done those multiple transfers. We've only done the one. Our next largest fund is again 037. So your third one down from the top there. And that one is at 81% expended. Again, under 92% is what we'd want to see. And as an agency as a whole, we're at 85%. So that's right where we want to be, bringing in more money than we thought and spending a little less than we thought we would. So that's right where we want to see. Bottom table all the way to the right, you just get to look at how efficient those funds are operating. If you were to look at that second column from the far right, that operating ratio one, would be at 100% or less if these funds were covering their costs one for one. That's what that 100% would mean. So you do see several of them that are over that 100%, and you would expect that due to the nature of the way our program structure is set up. Our programs, for the most part, do not cover their expenses, hence they get subsidized by the levy. So you'll see some funds there that are over that 100%. But overall, for the health department as a whole, so all the funds included, we're at 94%. So that's a really good operating ratio where we want to be, just slightly less there, but pretty much one for one exchange. Any questions about the income expenditure report? Moving on. This was a new format introduced last month to try and make the voucher summary a little less strenuous. It's bigger in print and a lot less information there. So feel free to just look at the summary page, and it just kind of summarizes the expenses for the month by line item. It shows you what the budget was for that line for the year, what was expended for the month, and where we're at year to date for that line. And then you would use 92% for that metric on where it's at in terms of total budget expended. If you want to dive deeper into the line, feel free to do that if you want to pull individual expenses out of there. But overall, it's summarized on this executive summary page. All those line items are at a total of 77% expended. So if you use 92%, underneath the 92% you'd want to use. And aside for some one-time expenditures that are around 98 or 96, all of them are right at that 92 or below that you would want to see. So non-personnel expenditures look good too. Any questions over the voucher summary? Moving on. This is going to continue to get longer and longer. Good thing next month is the last month. This is the appropriation transfers for the month. This is moving budget from one line to another to wrap up end of the year expenses, basically. So you may see a lot of movement into just lines within a fund as we're moving a lot of its remaining appropriations around without taking cash out of the savings account, if you will, for that fund. So the largest one you'll see on there is the 1.3 million that the board approved to establish that new general fund for Cheryl's team that finally got processed. So that 1.3 shows up in your appropriations. The majority of the rest of them are just putting budget in there to finish out any expenditures we foresee for the rest of this year, as well as anything that we would possibly get as an operating bill in the beginning of 2026. We would encumber to carry forward, so it wouldn't be a then and now. Since we will be locked out of the auditor system for a little bit in 2026, we won't be able to put any POs on. Any questions over the appropriations transfers? Those finance report.
Yeah, no. Okay, we need a motion and a second to approve the monthly income and expenditure report, voucher summary, and the appropriations transfers. Second,
I'll second.
any discussion? All in favor, say aye. And to Angie wants to vote. Thank you. Okay, it is approved. We'll move on to governance reports. Governance committee, that's Nancy. There's no report, no meeting. Performance evaluation committee is Bill, and there was no meeting. Planning and finance committee, Mark.
Yeah, we had a meeting today to go over the refined budget for 2026 and looked at the strategic priority for 2026, and we approved each of those, and so we had some good, robust discussion. But yeah, it was approved by the committee. So all we need is a vote to approve to move forward.
If you wanna I call them what the motion is.
The motion is to approve the 2026 refined budget as well as the strategic priorities.
All in favor, say aye.
Aye.
Opposed? And Angie, do you want to vote? Okay, it is approved. And we'll move on to new business. I think we have Lance Honor here, and he would like to talk to it tonight.
Yes, ma'am. My name is Glenn Connor. I came, not last meeting, but the meeting before, I had maybe last meeting. And I discussed with you guys the raising of rates on the permitting for new designs and how you weren't meeting the standard. If you were going to raise your rates, you weren't meeting the standard that you needed to meet. At the time I made that presentation to you, between there and the next meeting, I actually put in and submitted for another design, actually a design that was approved. We just needed a redesign. Original design took 21 days from the time I turned it in to the time I got it back. The second time, same design, same property. I turned it in. This time it was better. Took 14 days. Problem that better is better. Still not good, but it's better. Problem I have with the process is after the meeting that Melissa and Shadrach and I had, it appears that the design was lost for 4 days and nobody knew what was going on with it. Definitely something that could be cleaned up in that process to cut it from, because we cut it 7 days from 21 to 14. 14, if you take out the lost paperwork for 4 days, you could get down to something that it would be consistent in what you're wanting to charge. That I believe if I'm going to come and tell you that you're not doing a good job, I also believe I need to come and tell you that, hey, you're getting better. Keep working. Not there, but better is better. So I appreciate that.
Yeah, thank you, Mr. Connor,
Thank
and
you.
thank you for meeting with us at that meeting. And again, it's our hope, that we can get to a point where certainly you're satisfied as, an installer for us. I know your customers are satisfied with your work. And Shadrach is committed to the quality improvement project that one of our board members suggested to us 2 months ago. So thank you again.
And I appreciate you guys, like we said in the meeting. I'm here because I want it to be better. I'm not just an installer in Greene County. I live in Greene County. We want it to be better. And I appreciate you taking the time. And I'm sorry, I wrote your name down, but I've got Noah. Thank you for being there as well. I want it to be better, and I wouldn't have came if I just wanted to complain. We're going to work together and make it better. So thank you for my time, and guys have a good evening.
Oh, thank you.
Thank you.
Thanks for coming by.
Okay, next is the EPH employee wage and accrual summaries.
You want me to just do it again, or that's what
You should
we?
just say it's provided as
Yeah.
information.
Yes, it's provided as information and was previously discussed. It's on this page, excuse me. It's got a lead sheet with it back here with the gray subtitles. So some information about wages, allowances, and turnover for 2025.
And then, it's the CPH community participation spreadsheet. Want to things about that or?
Yes, so I want the board to be aware of all of the meetings that we attend throughout the health district and all of the community participation, community engagement, to really make public health better in Greene County. So it's just a list of who goes, what the meetings are, maybe how often they attend. So it's for your information.
And then, the last thing is the December lunch and learn will take place on December 11th. And all board members are invited to come. And the training begins at 9:30, followed by an employee meeting. And then lunch is served at 12. And if you're going to come, let Olivia know that you're attending. Oh. You haven't booked them. Good.
But it's not traditional holiday
Okay.
meal this year. I said 2025 is nothing like what I expected it to be. And so we're doing pizza. The only other thing I would add from the health district's perspective is that we have ongoing concerns about vaccine preventable diseases here in Greene County. We've had the suspect measles, pertussis, of course. And we continue the fight on, promoting immunization in the community. Ashley asked me before the meeting about we have not provided immunizations out of this health department since about 2016, 2017. When we worked with Five Rivers, all of those direct clinical services went over there. I looked today at kindergarten vaccination rates, the latest ones available from the state went through 2023. So overall vaccination status for our kindergartners is right in line with Clark County and Warren County, right around 90%, which is less than where it needs to be. But certainly the question is raised, well, is it harder than for Greene County children specifically to get the shots? And the answer is no, because we're keeping pace with both Clark and Warren County. But if they have Star Pediatrics over there, and so the pediatric population is being served by them.
Great, thank you.
Dr. Sheridan.
Yeah, Dr. Sheridan.
Well, I mean, there are other, I don't know how many VFC sites there are in the county. I know our rural health clinics are vaccines for children sites. So there's other in the private pediatrician offices as well. So I mean, there's certainly, I think, ample access for vaccines for that population. Now, speaking of vaccine, I'll just give my little report now. Is that okay?
Great.
The thing that's interesting right now really about vaccines is to watch, and you can watch this through whatever news outlets you like to look at, CNN or Fox or whoever you like to get your news from. But there's a big turmoil within the CDC right now about vaccines. They were going to have a vote today to take away the recommendation for the hepatitis B vaccine for infants. And there are two factions within the CDC, the old guard and the new guard. And whatever your politics are, we're not going to go there. That doesn't, that's it. This is interesting to me beyond the political realm that experts are going head to head against experts. One faction arguing against the vaccines and one faction arguing to keep the vaccine. So it's going to be interesting to see. We've already seen changes in vaccine recommendations. It appears that there is a move on within the new administration and the new leadership at the CDC to really radically change the way we look at and utilize vaccines in this country. So it's going to be interesting to see how that plays out. As far as talking about vaccines, flu vaccines, influenza A is really active for this time of year. We're seeing more influenza A. I read one report where we're 6 times as many confirmed cases of influenza A this year compared to this time last year. That's a significant jump. We're seeing it in the office where every day I'm seeing people with influenza A. There's this new variant that you may have been hearing about, subclad or subclade, depending on how you want to pronounce it, K, which is an H3N2 variant. This latest vaccine, or the vaccine we're using this year, was not specifically designed for that variant. The vaccine is usually finished in February for the upcoming flu season, and this subvariant really wasn't identified until June, July. But it's fortunately, it appears though that this vaccine dramatically minimizes the illness from this subclade K. So if the question comes up or you wonder, is it still worth getting the flu vaccine? I believe it is, and probably more important now even than last year. We pivoted, at least I've pivoted, and I think our other providers have probably pivoted. Instead of having arguments or discussions with patients, depending on how you want to look at it, about the effectiveness of a vaccine in terms of preventing a viral infection, I don't tell them that anymore. In fact, I tell them, if you're going to get infected, you're going to get infected. You're either going to get infected with the protection of the vaccine and have minimal symptoms, or you're going to be infected without any protection and have very serious symptoms and very serious consequences possibly. I don't do scare tactics. I'm not trying to, and I tell them, I'm not trying to scare you. I do, for the majority of my patients, I tell them, I think you'll live. I don't think it'll kill you, but I think it'll make you miserable and may, derail your train for weeks, not days. And so, I have found and feel that people are either open to the vaccine or not. But if they are, there are still several that are kind of undecided, and you present it to them the right way. My experience has been generally they'll say, I'll get the vaccine. So anyhow, it's just vaccines are charged topics, but it does look like this year's vaccine is very protective, even from this new strain, the subclade K, that the vaccine is effective in minimizing the symptoms. Says it decreases hospitalization rates by 75%. So that's significant. So that's that. The other thing we're seeing a lot in the office this year, more, I think, than usual, earlier than usual, is the norovirus, which is the pukes. And I tell people it's like a hurricane. It doesn't last very long, but boy, it's devastating if you got it. And we're seeing a lot of that, a lot of the norovirus. So fortunately for most people, it's not a big event. I mean, with any kind of real long-term consequences, but certainly the most vulnerable, the youngest and the oldest and the ill in between, it doesn't take much to topple them over. So those are just things to be aware of. I mean, that's just what I'm seeing in the office on a regular basis now. So.
Thank you.
Yeah, that Nora will go through a whole family as quick as it goes out.
Do you have anything else?
I do not, thank you.
Well, I wanted to thank everybody. This is my last meeting that I'll be chairing. And Sylvia will be starting in January as chair. So that's been a good 2 years. And all of you more. And I hope you have a good holiday in your family. I'll have a good holiday.
Thank you for all you've done today.
And especially cookies.
And then yourself. Happy holidays to you too, Angie. I guess we can adjourn the meeting. That's pretty good. That's good.